Despite the progress in research, no matter the brilliant skills of the surgeon, we still cannot cure all patients with brain tumors. With these words, one can understand how a burning passion for neuroscience steered Dr. David Zagzag toward a lifelong goal of curing patients with brain tumors. And through his dedicated visionary research into their molecular basis, he has made great strides to help the world realize that dream. Born in Paris to an accountant father and homemaker mom, David began his amazing adventure in medicine at age 16 in perhaps the most prophetic of places, a medical library. Taken there by his older brother, David was exposed to medicine and research in a way that has captured his imagination ever since.
Basic science research in neuro-oncology is really a critical part of my day. I think that this will potentially lead to better therapies for the patients affected with brain tumors and will allow us to have better targeted therapy that will destroy the tumor cells and the tumor cells only.
He attended Lariboisière Saint Louis School of Medicine in Paris, and it was there that his studies first revealed to him the wonderful complexities of the human brain.
I was trained at the University of Paris in classical neurology, and it was in medical school that I first encountered patients with brain tumors.
He graduated in 1984 and went on to McGill University in Montreal, where he earned a PhD. While at McGill, David was exposed to the study of brain tumor pathology, which was to become a lifelong obsession.
I moved to New York University, where I got further training in pathology and neuropathology, and I have since then devoted my time to understand brain tumors better.
After graduating, David devoted his career to pioneering research into tumors of the brain. His work revolutionized the understanding of how a tumor develops. In addition to his research, David has published more than 120 peer-reviewed scientific articles. He also oversees the New York University Brain Tumor Center Tumor Bank and participates in a number of professional societies and organizations.
My 5 years as the chair of the Professional Advisory Board for the Children's Brain Tumor Foundation was a unique and incredible experience. I was involved in deciding which of the grant applications will be funded. This is an absolutely critical step in promoting understanding of this disease and a very important contribution for the patients and their family.
This is one of the most difficult type of cancers kids can have. As a team, we're trying to do the best we can to improve their outcome.
So David, this is a 19-month-old baby with a very large, unusual looking posterior fossa tumor. It's in the superior aspect of the cerebellum adjacent to the midbrain, coming right under the tentorium. We think it may be some type of malignant tumor like an atypical teratoid rhabdoid tumor. It's grown quite a bit over the last 2 weeks, so we'll definitely need a frozen section. So your help is very important.
The highs of my professions primarily consist when I'm given a specimen from a child and I can give the neurosurgeon a diagnosis of a benign tumor or even sometimes a non-neoplastic disease that mimicked a tumor on the images. The lows when we look at very, very aggressive tumors under the microscope, or we can already imagine the kind of therapies these children will have to go through. Our team includes a variety of experts from a variety of fields. You can see here the vasculature of this, as well as the individual cells. Collecting tissue is a critical daily effort in this laboratory. We use this tissue to understand the disease better. We use the tissue to render a diagnosis that will establish the prognosis, and more importantly, we can tailor therapy to target specific molecules that play a critical role in the development of these tumors.
None of this could have been accomplished without the steadfast support of his wife, Tanya, a registered visiting nurse, as well as their 3 children, Yvonne, Anna, and his eldest, Jonathan, who is himself attending medical school at NYU. For more than 20 years, Dr. David Zagzag's passion for brain science has led him to contribute immeasurably to improving survival outcomes in patients with brain tumors. He has devoted his life to research, writing, lecturing, and educating others about brain tumors.
Understanding what these families, what the patient go through, makes me much more determined to pursue what I do in the lab and find a way to help these patients.
And if the cure sometimes seems a long way away, it does not deter him. The most rewarding aspect of his work, he says, is not just the personal gratification of accomplishment, it is the personal challenge to find the cure. And as for that young schoolboy from Paris, now a world-renowned neuropathologist, it is this challenge that drives him every day.